Okay, so we will start discussing from Dr. Salman's letter. Okay, and let's see how it goes. Okay. Okay, date is fine, no problem over here. Then rest of the things are good. Okay, I have problem with this regards. Mr. James Smith. See, this is not Mr. Remember. Why it's not Mr. Let me be very clear. I told you guys in the very first writing section and in very first writing class where I explained how to write a letter, right? And I explained that whenever the age of the patient is less than 16, there should be no Mr., right? But now you have written the Mr., which is wrong. And it's quite a mistake, okay? So don't add Mr. here, okay? Mr. should not be here. Okay, not good. Then let's talk about other things as well. So I've now the how should I be it should have been written. You just have to write James. I'm writing to refer James, okay, into your care for assessment and suitability of double lung transplant. Okay, where is the reason? Why are so you are demanding, but where is the reason? Very poor purpose, okay, not according to the criteria, okay, that I actually explained, okay, so no problem. Came in the respiratory unit from emergency department at see, you don't need to write that patient came from this hospital to that hospital, from this department to that department, irrelevant. Important thing is symptoms. So write dates, name, and then symptoms. Shortness of breath, coughing, hemoptysis, fever, headache, and facial pain. On examination, he was widely stable with O2 saturation of 80% and breathing rate of 30 per minute. He had erythematous oropharynx, sonorous wheeze, and bibasilar crackles. He was prescribed ampicillin. See, generic names should be written in small letters. So A should be small. Sulbactam and supplemental oxygen was also given. Just write supplemental oxygen. That's done. There is no need to write was also given because the sentence is completed till supplemental oxygen. On next day, not Mr. Smith, James was stable. His chest X-ray not shows. Again, you are not writing in the present indefinite when you are talking about past, right? So on next day or on subsequent day or on subsequent visit or on next day, you have to write James was stable and his X-ray showed, okay, pleural effusion and pneumonia, and his CT scan showed, not shows, showed chronic sinusitis. His treatment added, well, no, his treatment was changed, not added, okay? You are not adding into that previous medication. You are changing it. If you have read the case notes properly, it was written. It's changing, it's not adding, okay? And the way you have written the adding sentence, that is also wrong, okay? So his treatment was changed to azithromycin and ciprofloxacin, okay? And please, if you want to write this POQD, see, according to me, this is very wrong way of writing something. Just write azithromycin 500 mg and ciprofloxacin 500 mg. That's it. Nothing else. You don't need to tell me that, or you don't need to tell any reader, okay? Because this is an English language exam and they are not going to talk about the doses. It's okay to write doses. I mean, not talking about the time, okay? So you don't need it. you don't need to tell the reader. So I prescribe the medication patient has to take with the water after the dinner, before the breakfast, this and that, at 5 p.m., at 7 p.m. Okay, no need of that. See, they have given you the case notes so that you can select the relevant information. If they would have given, if their intention was to give you case note just because you have to write something and you just have to copy paste, then why would they take exam from you? They would just say, okay, take B grade, have fun. No, that's not good. Okay, so skip those things which are not relevant. Okay, telling patient or telling the reader that patient was taking per oral. I mean, is it possible to take tablet some other way? It is per oral, right? There's nothing else. I mean, it's a common sense, right? So we don't need to tell reader, okay, and we don't think that the reader is dumb, okay, that he doesn't understand the tablet is taken per oral. Okay, it's not injection, right? And when we say that injection, there could be intramuscular or IV. Okay, but even you don't need to mention that. Okay, on this date, James is stable. It's about today, right? So why are you writing dates? Better just write today. James is stable and his antibiotics are finished. I would not say finished is not a good word. You can write his antibiotic course has completed, would be a better sentence. Mr. Smith, no, again, see, this is where you guys make smoothie. Okay, uh, different fruits you're putting in the jar, mixing them very well. Outcome is really poor. Okay, so is and then was very poor way of writing letters and the paragraph. I explained these things to you guys very well over and over again. Please don't do these mistakes. These are not, now, after explaining, these are not mistakes, these are blunders if you're making it. And they are going to cost you a lot. And I don't want you to be there. Okay? Don't do that, please. Be very careful when you're writing. Read your own letter. If you're in a hurry, don't write it. Do not write a letter if you're in a hurry. Take yourself, give yourself time, take some time, relax, sit, write letter within 40 minutes, send it to me. If you think, okay, because I have to send a letter, okay, and I have 20 minutes, let's just write it. Don't write it. I don't want that letter. Okay, sit down, write in a peaceful environment, give yourself 40 minutes, just like exam, sit down, relax, read. However, whatever I've explained, use that knowledge, think about it, and then write rather than just write. Okay. It's not something that I've not explained and you already know because the previous letter was good. Okay. It means you know, but maybe you were in a hurry, but that's fine. Next time, be careful. Told about the possibility of increased frequency of lung infections and increased hospital visits. Is discharge. See, again, is. I hope you're getting my word. Now, this is what? This is a smoothie that you're making. Okay, like you are adding fruits and vegetables at the same place. Okay, so the combination is really worse. Okay, if you add apple, banana, plus chili, garlic, okay, into the milk, and you're thinking that the outcome is going to be great. No, that's not possible. That is going to be something which you will regret after making it. Okay, so this is something that you should regret about. Okay, his physio airway. Okay, see, remember in our very first class, I told you guys, do not use the short forms. You are writing a formal letter to someone who is actually going to give you score. Okay, and you have spent 1,20,000 to 25,000 rupees along with a lot of time and effort. You are not writing a letter to someone who who you think that, or who we think that they will take it easy. They will not take it. They are sitting to there to fail you. You have to pass on your own. If you think they will pass you, you are in a loop. Okay, and they are looking for these mistakes that you guys are making. Okay, his discharge plan suggested is physio. See, this is very poor sentence. Okay, maybe again you're in a hurry. Okay, doctor. So it could have been improved. You can just write his discharge plan includes physiotherapy for airway clearance. And in OET, there is no slash, there is no hyphen, there is no hashtag at the rate, nothing like that. Okay, you cannot, and there is no physio. Okay, the person, if you're writing a letter to me, I'm a tutor. I'm. You can say that I am someone who is teaching you or who is helping you. Okay, so I am not. We are not friends, right? We our communication is completely professional, so you cannot talk to me like friends. Okay, and you cannot talk to the reader who is reading your letter in exam like friends. It's not physio. Okay, come friend, let's go have fun. Physio. No, physiotherapy. Write the complete word. Don't say lab. Laboratory results, test results. Okay, full forms. There is nothing like short form. Okay, come on. That's not at the rate. This no hyphen, no at the rate, no physio. Full form. And to improve his direct diet after discussion with dietitian. His discharge plan includes airway clearance, okay, along with increased exercise, okay, and and modification of diet. Okay, that's it. You don't need to tell that I will send the patient to a dietitian. No. If you want to write, you can just write, then you can spare like end your previous sentence and you can write new one that in addition, he is asked to talk to dietitian or consult, okay, for his diet plan. Okay, so there are things that you can use to modify your sentences, but you have to think, you need time for that. You are not going to get these sentences in hurry, okay, because we are not native speakers, so we need practice, and for practice we need time. Okay, so at start, give yourself enough time. When you're pro in it, then there is going to be no problem. Medical history of chronic sinus infection and cystic fibrosis, for which he is taking paracetamol. Okay, again, so you're doing the same thing. Paracetamol 500 mg 6 hourly. Okay, so now I have got it 500 mg 6 hourly. Does that make any sense? Just write paracetamol, pulmozyme, crayon. That's it. With food, after food, morning, evening, 4 hours, 6 hours, 10 hours, after sleeping, before sleeping, doesn't matter. Wasting your words, okay? He also has focal epilepsy, for which he has been prescribed phenytoin. Has been prescribed phenytoin when? See, has been means you are writing in present perfect continuous. But you have written present perfect and I have no problem with it. But where is the continuous? Because he has not stopped. He's taking it. Epilepsy medications, you cannot stop. Okay. You might think about decreasing the dose. Okay. If you have read the criteria of the epilepsy, okay, you have to continue the medication. If you stop and the medication is gone, you're thinking that, okay, I'm done. No, the patient might have another epileptic seizure. Okay, so you cannot stop it. You have to continue, but the doses can be decreased, right? So if he's taking from last 10 years or 15 years, so he's gonna take it. So, but perfect means, okay, fine, but continuous in nature. Where is continuous? I don't know. Okay. 3 tablets daily. So 100 mg, 3 tablets. That's just right, phenytoin. That's it. I will take it. Everyone will take it. Okay, who is reading? In view of the above, I would be grateful if you kindly evaluate Mr. Smith Mr. not Mr. Smith. And even if you have to write Mr. Smith, like in other letter, Smith's condition, there should be apostrophe and S. Okay. And suggest him the best or appropriate one thing. Okay. Suggest him the appropriate treatment options. And there is no apostrophe over here, doctor. I've been explaining. Okay. Don't do this. These are very basic mistakes. Please avoid them. And where is the last sentence? If you have any queries, please feel free to contact me. That is important to write. Overall, this letter is not well written. Okay, maybe you are in a hurry. There is another letter of the same type, Joshua's letter. I hope you will write that letter better. Okay, similar type of letters are there. Okay, so try whatever I've explained, try to implement this knowledge on that letter so that you can have a better outcome. Okay, now let's just go to the next letter.